This next exercise in your core program is called the Clam. This exercise focuses on a small muscle at the back of the pelvis called the glute medius. Now this exercise is really important, particularly if you've had pain going into your leg. It may have caused you to limp or walk very stiffly as a result of the pain that you've been in. And this will help to address a very common muscle imbalance that can happen when you have been in pain and limping for some time. Now the positioning before this exercise is quite important. You do need to get yourself into the correct position. We'll be lying on our side with our head supported with a pillow. We want our shoulders stacked, one shoulder on top of the other, and our hips stacked, one hip on top of the other. In other words, I don't want my pelvis to be rolling backwards or my top shoulder to open. So we want to be nice and level, one shoulder on top of the other, one hip on top of the other. We need to have a nice flat straight back, and we want our heels to be in line with our buttocks. So lift the feet up and just have a glance down, and you'll see that that should then be in line with your bottom. In this position, you're then going to set your centre. Take a moment to take a deep breath in. As you breathe out, gentle 5 out of 10 contraction, drawing that belly button through towards the spine, and you're going to hold that throughout the exercise. What we're then going to do is very gently float the top knee up towards the ceiling and down again. Now what's very tempting to happen with this exercise is as the knee lifts, we'll tend to roll backwards. Okay, we don't want that to happen, otherwise our larger glutes can just come in and we'll be cheating. So what can be useful when you're first learning this exercise is just to place your hand onto your hip, so you'll then notice and feel that your hand is moving, which you don't want to happen. You want it to stay stock still. So we're going to float that knee up and then down again. The other thing that can go wrong is the foot could want to come with you. You want to keep those feet clamped together, okay, pressing those heels together as you float that knee up towards the chest, up towards the ceiling. Make sure you don't let the tummy muscles go. Keep that 5 out of 10 contraction and stay nice and relaxed through your neck and shoulders. I recommend you start with doing 10 repetitions on each side and then build up, if you can, to doing 2 minutes continuously on each leg. Now if you do notice a little bit of shaking or juddering of the leg, don't worry, that's just the muscles struggling. It probably means, to be honest, that we've got the correct exercise for you. If that muscle is struggling, then it'd be appropriate to have this strengthening exercise in place. Okay, so we'll set that up once more. So thinking about one shoulder on top of the other, one hip stacked on top of the other, nice straight back, feet in line with the buttocks, heels clamped together as we float that knee up towards the chest, keeping our core engaged throughout the whole movement. As I said, if you can build up to doing this for 2 minutes at a time, that would be absolutely perfect. Okay, well done.